Understanding AML. Acute myeloid leukemia, or AML, is a cancer that starts in the bone marrow, the soft inner part of the bone where new blood cells are made. Acute means that the cancer usually comes on quickly and gets worse quickly if it is not treated. Myeloid refers to the type of abnormal white cells that build up in the bone marrow in AML. These abnormal cells are called myeloblasts. Myelo means bone marrow in Greek, and blast means immature sprout. Leukemia means that the cancer starts in blood-forming cells in the bone marrow. These cancer cells often spill out into the blood that circulates through the body. AML is the most common type of acute leukemia in adults. More than 20,000 new cases of AML occur in adults every year in the United States. Children can also get AML. However, AML in children is a little bit different from AML in adults. In this animation, we will be focusing on AML in adults. AML happens when a sick seed cell in the bone marrow, called a stem cell, fails to mature into a healthy blood cell. Instead, the abnormal stem cell gets stuck at an early stage of development called a myeloblast, or blast for short. Having a few blasts in the marrow is normal. In healthy people, myeloblasts are rare, only 1 or 2 out of 100 cells in the marrow. In AML, these blast cells are increased, at least 20 out of every 100 cells in the marrow, or greater than 20%. When abnormal blasts build up in the bone marrow, they crowd out healthy blood cells. As a result, levels of healthy white blood cells, red blood cells, and platelets are low. White blood cells help the body fight infection. Red blood cells carry oxygen, and platelets prevent bleeding. Blasts can spread into the bloodstream and to other parts of the body, such as the skin, gums, and brain. AML, like other cancers, develops because of changes in genes. In most cases, these changes in genes are not present at birth or inherited. Instead, they are acquired during life, as a result of an accidental error when a stem cell is copying its DNA. More than 50 different genes have been found to be abnormal in patients with AML. Most patients have between 3 and 6 different gene changes in the blast cells. Understanding what genes are changed in AML helps doctors make treatment recommendations and predict the patient's outlook. When AML is in its early stages, most people have no symptoms. When symptoms appear, they often appear abruptly and can feel like the flu. Symptoms may include unexplained fevers, feeling short of breath, weak or tired, feeling cold, feeling dizzy, headaches, losing weight or losing your appetite, bruising or bleeding easily, pale skin, small, flat, round, red spots under the skin that are caused by bleeding, called petechia. AML can occur at any age, but older people are at the highest risk. The average age when people are first diagnosed with AML is around 65. Others with a higher risk for AML include people who smoke, people who have been exposed to the chemical benzene, which is found in solvents, gasoline, older pesticides, and tobacco. This chemical is rarely encountered today. People who have been treated for cancer with radiation or with some kinds of chemotherapy. People who have had myelodysplastic syndrome or other bone marrow disorders. People who inherit certain abnormal genes. And rarely in people with a close relative who had AML. Acute promyelocytic leukemia, commonly called APL or APML, is a distinctive subtype of AML. In APL, as in AML, the bone marrow makes too many immature cells that can't develop into healthy white blood cells. Acute means that these immature cells build up quickly in the bone marrow, crowding out healthy white and red blood cells and platelets. Promyelocytic refers to the immature cells that don't develop into healthy young white blood cells as they should. APL is caused by a mistake in the structure of 2 chromosomes. A piece of chromosome 15 breaks off and attaches itself to chromosome 17. As a result, seed cells, or stem cells, get stuck at a stage of development called the promyelocyte stage, which is the next stage after myeloblasts. Then, these cells start to grow uncontrollably. The symptoms of APL are similar to those of AML, but patients diagnosed with APL may also present with active bleeding, extensive bruising, or new blood clots. People with APL tend to be younger than people with other types of AML. The average age of people when they are first diagnosed with APL is 44. APL has a better prognosis or outlook than AML, but there are increased risks of bleeding or clotting in the early phases of treatment. Right now, there is no sure way to prevent AML. However, quitting smoking or not starting may reduce the risk of getting AML. There is no standard screening test for finding AML early, like a mammogram to check for breast cancer or a colonoscopy for colon cancer. People at high risk for AML should get regular medical checkups and should talk to their doctor about whether they should get a periodic complete blood count, or CBC. That's a basic blood test that's used to help diagnose AML. A hematologist is a doctor who specializes in treating blood diseases, including cancer. Many patients with AML are also treated by oncologists, who are doctors that treat other types of cancer. If you still have questions about AML, talk with a hematologist or oncologist who specializes in treating this type of blood cancer.
We are from group 3. We would like to talk about and present about acute myeloid leukemia. So let's begin our presentation.
Hi, Assalamualaikum. My name is Nurul Fatin Afrina binti Abdul Kadir and my matric number is H22A0282. I'm from group 3. For assignment group, we will research about disease of acute myeloid leukemia. First of all, acute myeloid leukemia is a cancer of myeloid line of blood cells, characteristic by the rapid growth of abnormal cells that build up in the bone marrow and blood and interfere with its normal blood cells production. From this assessment, in this section, we will explain about the case report related to this disease, which has been reported by the hospital, and explain how it happens to sufferers of this disease. Next, each discussion for this part, we gonna know the fact of this. We will also state the factor that cause this disease to occur, the side effect, and how to cure the patient by doing some treatments. Introduction: leukemias are cancers that start in cells that will normally develop into different types of blood cells. Most often, leukemia starts in a early form of white blood cells, but some leukemias start in other blood cells types. There are several types of leukemia, which are divided based mainly on whether the leukemia is acute. Acute myeloid leukemia starts in the bone marrow, the soft inner part of a certain bones, where new blood cells are made. But most often it quickly moves into the blood as well. Overall, but sometimes AML develops in other types of blood forming cells.
My name is Nur Asha Adriana bint Ridwan. My nomenclature is H22A0528. My presentation is case report 47-year-old woman. A 47-year-old woman present to the emergency department complaining of fatigue and shortness of breath. She reported a 2-week history of worsening exercise tolerance and a rather abrupt onset of shortness of breath over the past several hours. The patient has no major past medical history and worked as an architect. Prior to his illness, she exercised 3 to 4 times weekly. Her breathing appears somewhat labor. Physical examination is notable for tachycardia, tachypnea, and erythematous rash on her chest and back, and scattered ecchymosis on the extremities. His laboratory results reveal the following: white blood cell and hemoglobin. Okay, thank you.
Assalamualaikum, my name is Roslida Wati binti Muhammad Ramli. My metric number is H22A0432. Today I want to present about case report 26 months boy. Clinical features are not different from other type of AML, but organomegaly is not infrequently in adults. In your patient symptom of anemia that is progressive weakness and diabetic were symptoms. Cytopenias are usually present, but 30% of patients have platelet count over 10,000 UL, but in our case, who had low platelet count 40 to 109 liter. Osteosclerotic and osteolytic lesions have been described in a few case reports. The diagnosis depends on the expression of at least one platelet antigen, CD41, CD42B, and CD61 on the leukemia cells. In our patient bone marrow aspiration was done that showed increased abnormal megakaryotic, karyocytic, monolobated, and multinucleated karyocytic with hyperchromatic and pleomorphic nuclei were seen and showed that leukemia cells were positive for CD13, D33, CD42, and CD61, and negative for CD3, CD5, CD7, CD20, CD22, and human leukocyte antigen. The cytogenetic analysis was not carried out in this case. AML M7 may present as de novo leukemia, secondary leukemia after chemotherapy or transformed myeloproliferative disorders and myelodysplastic syndromes. This report describes a presentation of AML M7 with thrombocytopenia, although non-specific cytogenetic abnormalities are more frequent over 90% in AML M7 than in other subtypes of AML. The prognosis is significantly poor in AML M7 with megakaryocytic blast crisis. AML M7 by itself is an adverse prognosis factor for disease-free survival. Thank you.
Okay, discussion, I will tell you about the symptom of the disease, which is AML, acute myeloid leukemia. Okay, and also I will tell you about the effect of AML. Effect is typically from the bone marrow. Okay, next is I will tell you about the type of blood, type of white blood cell, and the risk and the classification. Okay. The last is I will tell you about the how to treat this disease by doing some therapy. Okay, we're gonna start with symptom. Okay, firstly, symptom of this disease usually is fever, bone pain, lethargy, fatigue, lethargy, or we can say tired, shortness breath, pale skin, frequent infection, easy breathing, unusual bleeding, and currently when they have a bleeding, usually bleeding on the nosebleed, and also bleeding from the gum. Okay, we're gonna continue with effect of this disease. Okay, from effect typically on the bone marrow, which is blood stem cell, immature cell that become mature blood cell over time, and a blood stem cell may become a myeloid, or lymphoid stem cell. A lymphoid stem cell become white blood cell. Bone marrow, the soft inner part of the keratin bones, is made up blood forming cell. Fat cell supporting tissue, small fractions of the blood as the blood forming cells are blood stem cell. Okay. Next is three type of the blood, which is I'm gonna tell you about the red blood cell, platelets, and also white blood cell. Okay, but red blood cell usually carry oxygen from the lung to all other tissue in the body and take carbon dioxide back of the lungs to be removed. Okay, for platelets, currently fragment made by the type of the bone marrow cell called the megakaryocyte platelet are important to stop the bleeding. They help plug up holes in the blood vessel and blood vessel that can cause cut of the breast. Okay, last is white blood cell. White blood cell help the body to fight the infection. So they together to make the virus to make the cancer. They fight together, which is white blood cell. They fight the. So I'm gonna continue with the type of white blood cell. There are three type of blood cell, which is granulocytes, monocytes, lymphocytes. Okay. Granulocytes is to show up a support under the microscope. These are granulate contain enzyme and other substance that can destroy the germ, such as bacteria. The type of granulates is there are three, which is neutrophils, basophils, and eosinophils. Okay. Next is monocytes. After circulating in the bloodstream for about a day, monocytes enter body tissue and become macrophage, which is can destroy some germ by surrounding and digesting them. Okay, lastly, lymphocytes. Lymphocytes is the main cell that make lymph tissue a major part of the immune system. Okay, usually lymph tissue found in the lymph nodes. The thymus, a small organ behind the breastbone, the spleen, the tonsil, and adenoids are scattered throughout the digestive and respiratory system. Okay. Okay, next is I will tell you the two of risk classification, which is there are two. One is low risk AML mutation, and next is high risk AML mutation. Okay, for low risk, the diagnosis, molecular diagnosis, investor 16 AML SEBP qAML and 821 AML NPM nucleophosphine. Okay, for high risk is mutation. This is the very dangerous because it can become abnormal chromosome 5 qAML and mandatory 7 AML FLT3 high allelics radio AML. Okay, currently among the many type of mutation that can cause AML, there are only a few that are known to impact the risk. Failure, these are grouped into the. I'm gonna tell you about the how to treat the disease by doing some treatment. For patient who face this disease, they need to have a currently therapy, which is chemotherapy, radiation therapy, and last is chemotherapy with the stem cell transplants. Okay, I will read a little bit how to treat this therapy. Okay, first is cancer treatment. Chemotherapy, they're using a drug to make the stop grow cell, and either by killing the cell. Okay, next is radiotherapy. Radiotherapy cancer treatment, they use highly energy and X-ray, make some X-ray or others, and particularly type of radiation to kill cancer cell or keep them from growing. Okay, for radiation therapy. Okay, next is chemotherapy. Chemotherapy with stem cell transplant. Chemotherapy given kill cell, healthy cell including blood forming cell, and also destroyed by the cancer treatment. Usually, stem cell transplant is a treatment to replace the blood forming cell, stem cell, immature blood cell. So they change the blood cell become immature blood cell. Okay. Next is stem cell grow into and restore and the body cell. Okay, that's all from me. Thank you.
My name is Chandra Binti Ghazali. For the last part is conclusion. In conclusion, for this study, I found that this can lead to death because it involves blood cancer that has occurred in the bone. Therefore, patients need to seek immediate treatment to prevent it from getting worse and difficult to treat. The longer the disease is treated, the higher the risk has debilitating pain and loss of life. There are many ways to treat a modern is taking medication, being treated by pediatric oncology, and chemotherapy treatment.